Margaret was 71, and she had run her own bookkeeping business for 30 years without ever missing a number. Then, one winter, she started forgetting client names. Then she forgot the drive to her own office, a route she had taken 5 days a week for 2 decades. Her family called it aging. It wasn't aging. It was the little pink allergy pill on her nightstand, the one she had swallowed every single night for 4 years. Her memory came back within months of stopping it, and almost nobody had told her that was even possible. I'm Dr. Alex. I've spent years in emergency medicine, and I want to be honest with you about something the pharmacy counter almost never explains. Some of the most common medications in America, drugs sitting in ordinary medicine cabinets right now, can quietly pull down your memory and your thinking, sometimes within a single year. Not exotic drugs, not mistakes, pills a doctor prescribed and a pharmacist filled, working exactly as designed with a side effect nobody flagged. Here's what I've learned watching this happen over and over. It almost always traces back to just 3 mechanisms. 3 ways a medication reaches into the brain and dims it. Once you understand those 3, you stop needing to memorize a scary list, because you can look at your own shelf and know which bottles to ask about. So, I'm going to walk you through all 3, then the one class that frightens me more than any other. And near the end, I'll give you a 2-minute check you can do tonight with the bottles you already own. Stay with me for that part, because it's the piece that actually protects you. And let me say clearly up front, so there's no confusion. Nothing in this video is a reason to stop a medication on your own. Every single fix here runs through your doctor or your pharmacist. What I'm handing you is not a stop button. It's a better set of questions than you were ever given at the counter. Let's start with the first mechanism, because it's the biggest one and the most overlooked. Call these the memory chemical blockers. Your brain runs on a messenger called acetylcholine. It's the chemical that lays down a new memory and keeps you alert through the day. Here's the part that matters for anyone over 60. As we age, the brain naturally makes less acetylcholine, so it leans harder on every bit it has left. A drug that blocks that chemical lands far heavier on a 70-year-old brain than a 30-year-old one. Think of acetylcholine as the ink your brain writes memories with. These drugs don't damage the pen. They just quietly run the ink dry. The part of the brain that takes the hit is the hippocampus, a small seahorse-shaped structure deep in your head, where a fresh memory first takes shape before your brain stores it for the long term. It is one of the most acetylcholine-hungry regions you have. So when a drug blocks that chemical, the hippocampus is the first place to feel it, and losing the ability to file new memories is exactly what early dementia looks like from the outside. The name of the day, gone. The conversation you just had, erased. The word on the tip of your tongue that never arrives. The one almost everyone has is diphenhydramine. You know it as Benadryl, and it hides inside most anything labeled PM, nighttime, or night for sleep. It's a few dollars, it sits on an open shelf, and people assume that because it needs no prescription, it must be gentle on the brain. It is not. A landmark study from JAMA Internal Medicine, following older adults for years, found that the heaviest long-term users of these anticholinergic drugs had roughly a 54% higher risk of developing dementia than people who stayed off them. Half again the normal risk, from something a lot of us treat like candy. And a separate analysis found the risk climbed the longer people stayed on them. Which tells you this isn't about one bad night of sleep. It's about years of small nightly doses adding up. Now, I know exactly what some of you are thinking, because I hear it in the ER all the time. Doctor, I've taken that pink pill every night for 10 years, and my mind is fine. Maybe it is. But here's the trap with this particular side effect. It doesn't announce itself. There's no headache, no rash, no bad reaction that sends you to the doctor. It's a slow dimming, and because it's slow, the people around you adjust to it and call it aging before anyone thinks to question a bottle. The absence of an obvious warning sign is not proof of safety here. It's the whole reason this goes unnoticed for so long. The same mechanism shows up in a bladder medication, oxybutynin, sold as Ditropan, given for that sudden urgent need to reach the bathroom. It works by blocking the very same memory chemical, and it slips into the brain easily. It shows up again in amitriptyline, an old antidepressant still handed out for nerve pain, sleep, and migraines. And it is one of the strongest brain blockers still in common use, even at a small nightly dose taken for years. And it shows up in one specific antidepressant, paroxetine, sold as Paxil. Most modern antidepressants leave acetylcholine alone. Paroxetine is the exception, which is exactly why the American Geriatric Society lists it as a medication older adults should generally avoid. Same mechanism, 4 different bottles, 4 different aisles of the pharmacy. Now, none of this means you stop anything on your own. It means you now know the right question. If you take a nightly antihistamine for sleep, ask about a newer allergy pill like loratadine, sold as Claritin, that doesn't cross into the brain the same way. If you take oxybutynin, ask about mirabegron, sold as Myrbetriq, which controls the bladder through a completely different pathway and doesn't touch acetylcholine at all. There is almost always a gentler door. Most people just never learn there's a door. That's mechanism 1. Mechanism 2 is different. These don't block a chemical. They sedate the whole brain. The main players are the benzodiazepines, lorazepam sold as Ativan, diazepam sold as Valium, and alprazolam sold as Xanax, prescribed by the millions for anxiety and sleep. They work by boosting GABA, the brain's natural calming signal, and at first they feel like a rescue. The panic eases, sleep finally comes. But over months, that same calming turns into a low chemical fog. Learning slows. Mental flexibility drops. People describe an emotional flatness, like they're watching their own life from behind glass. The longer-acting ones, like diazepam, are worse because they build up in the fatty tissue of the brain and stay there. I think of a man I'll call Frank, 68, a retired electrician from outside Cleveland. He'd been on a nightly anxiety pill for 3 years, and his daughter brought him in convinced he was developing Alzheimer's. He was losing words mid-sentence, dozing off in the afternoon, flat and far away. It wasn't Alzheimer's. It was 3 years of low-grade sedation his brain had never gotten a break from. Over 4 careful months of tapering with his own doctor, the fog lifted. The man came back. That's not a miracle. That's just what happens when you stop sedating a brain that was never sick to begin with. And here's the part I need you to hear clearly, because it's a safety issue, not just a memory one. If you have been taking a benzodiazepine for more than a few weeks, do not stop it suddenly. Stopping cold can trigger seizures and can genuinely be life-threatening. This is one you taper slowly, over weeks or months, with your doctor, often trimming the dose by a small fraction every couple of weeks, so the brain has time to adjust. There are gentler paths, a medication called buspirone for anxiety that doesn't sedate, and a specific kind of talk therapy for insomnia, called CBTI, that in head-to-head studies works as well as a sleeping pill without the cognitive cost. The goal is never to quit in a panic. The goal is a plan. Mechanism 3 is the sneakiest because these drugs never touch the brain directly at all. They starve it. I'm talking about the proton pump inhibitors, omeprazole sold as Prilosec and esomeprazole sold as Nexium, taken for heartburn and reflux. They shut down stomach acid, and people stay on them for years because the moment they stop, the burning roars back, so it feels like the pill is the only thing holding the line. But here's what the counter doesn't mention. Your gut relies on that acid to unlock certain nutrients from the food you eat. At the top of that list is vitamin B12, the nutrient that keeps the insulation on your nerve fibers intact and your brain signaling properly, along with magnesium and calcium. Suppress the acid strongly enough, for enough years, and your B12 level slowly drifts down. And low B12 can mimic early dementia almost perfectly. The confusion, the memory slips, the unsteadiness on your feet, except the true cause is a nutrient. Your daily pill has quietly kept you from absorbing. That's why the American Geriatric Society flags routine use of these drugs beyond 8 weeks in older adults. Most people have been on them for 8 years. There's a second layer to this one too. Magnesium is the mineral your nerve cells use to fire cleanly and calm themselves down, and low magnesium alone can cause confusion, muscle cramps, and a racing heart. So a single, long-term reflux pill can quietly pull down 2 different things your brain depends on at the same time. This is why the concern isn't heartburn itself, it's the years. A few weeks of one of these drugs to heal an irritated stomach is reasonable medicine. A decade of it, on autopilot, refilled without anyone rechecking, is where the trouble lives. The move here isn't to suffer through heartburn. It's to ask whether you can step down to a gentler class called an H2 blocker, like famotidine sold as Pepcid, and whether simple changes, smaller meals, not lying down within 3 hours of eating, raising the head of the bed a few inches, can carry part of the load. And if you've been on a proton pump inhibitor for years, ask your doctor for one simple blood test to check your B12 level. That test costs almost nothing and answers a huge question. And if your level is low, it's often fixable with nothing more than a supplement or a shot. I want to add one more that lives in a gray zone, because I don't want to scare you off a drug that may be saving your life. Statins like simvastatin and atorvastatin are among the most prescribed medicines on earth, and for many people they genuinely prevent heart attacks and strokes. This is not a case against them, but your brain is nearly 60% fat, and it uses cholesterol to insulate every nerve. Some people on higher doses report a mental fog, and the important, hopeful detail is that not every statin behaves the same in the brain. Some cross into brain tissue easily, and others barely do at all, so if fog is a real problem for you, there is often room to switch to one that stays out of the brain while still protecting your heart. If you've noticed fog since starting one, that's a real conversation about a lower dose or a different statin, not a reason to quietly stop a medication protecting your heart. I put statins in the gray zone on purpose, because the answer here is almost never stop. It's adjust and pay attention. The difference between those two matters enormously when the drug is also lowering your risk of a heart attack. Now here's the part I promised you, and it's the one I'd want my own father to hear. Everything I've just described is cumulative and mostly invisible, which means the danger isn't usually one dangerous pill. It's 3 or 4 ordinary ones stacking up, the allergy pill plus the bladder pill plus the sleep aid, each one a little block on acetylcholine, adding up to a load nobody ever measured. So here's what you do tonight. Pharmacists and researchers use something called an Anticholinergic burden score. You don't need the chart. You just need to line up every single bottle you take, prescription and over-the-counter, on your kitchen table, and count how many are on the list you just heard. The PM sleep aids, the older allergy pills, the bladder drugs, amitriptyline, paroxetine. If you count 2 or more, that's your number, and that's the number you carry into your next appointment. Put every bottle in a bag and bring it. It's called a brown bag review, and if you're on Medicare, a full medication review with a pharmacist is a covered benefit most people never use. Doing that one thing once a year catches more of these problems than anything else I know. That brings me to the class that worries me most of all, because so many people taking it never agreed to what it actually is. Antipsychotics, quetiapine sold as Seroquel, risperidone, and olanzapine. These were built for serious psychiatric illness like schizophrenia, but today they're often handed out off-label to older adults for sleep, restlessness, or the agitation that can come with dementia itself. A family is told grandma is getting something to help her settle. Nobody says the word antipsychotic. And here's the fact that should stop you cold. The FDA placed its strongest possible warning, a black box warning, on these drugs when used in older adults with dementia because they measurably raise the risk of death. That is not a memory side effect. That is the highest level of alarm American regulators can issue, and it's on a drug quietly given in homes and nursing facilities every day for nothing more than confusion. I'm not telling you this to frighten you and walk away. I'm telling you because there is almost always a next step, and the news is better than it sounds. A lot of what these medications take, they give back. When Margaret stopped her nightly pill, her memory returned over months. Frank got his words back. That happens more than people expect, because much of this fog is chemical, not structural, and chemical things can be reversed. The word for it is deprescribing, and good geriatric doctors do it on purpose, carefully peeling away the pills a body no longer needs. Here's the mindset shift that matters. Every pill you take earned its place at some point, but bodies change, and a medication that made sense at 55 may not make sense at 75. Nobody ever schedules the appointment to ask, "Do I still need this?" That appointment is the most valuable one you're not booking. And this is where I'll gently push back on a belief I hear constantly that more medication means more careful care. Sometimes it does. But for older adults, the safest prescription is often one fewer bottle, not one more. The best doctors I know measure their work not just by what they add, but by what they can safely take away. So let me give you the latter, so you know what to do with all of this. If you notice new fog or forgetfulness, first, don't panic and don't stop anything cold. Write down when it started and what changed. Bring that note and the brown bag of bottles to your primary care doctor or pharmacist and ask directly, could any of these be affecting my memory? If the fog is getting worse fast, get seen this week, not next month. And if there's ever sudden confusion, trouble speaking, or a facial droop, that's not medication, that's a stroke. And you call 911 right away and don't drive yourself. Let me leave you with the one pattern to remember, because if you forget everything else, keep this. 3 mechanisms: blockers, sedators, and starvers. The blockers dry up your memory ink, the sedators fog the whole brain, and the starvers cut off the nutrients your nerves run on. You don't need to fear your medicine cabinet. You need to read it. Line up the bottles, count how many are on tonight's list, and carry that number to your doctor. Not to quit anything in fear, but to ask a better question than you were ever offered at the counter. If someone in your family is sharp one year and slipping the next, and everyone around them is calling it age, do them one favor. Show them this, and help them line up their bottles. The cause might not be their brain at all. It might be something you can carry in a paper bag to a doctor's office. And that is a very different and far more hopeful kind of problem to have.